Tell me your story.
I was this close to dying from a brain abscess that was misdiagnosed.
Good to know people care, though.
For a lot of people, the MRIs are clear.
You said you had a lot to tell.
Oh, yeah.
Someone said,
I thought it was normal to have like seizures by yourself all the time.
You definitely will feel guilt a lot.
I so appreciate you putting this together.
thank you. Has anyone else had this experience? I've tried Keppra and Lamictal, but both were awful for me. I was having intense anxiety and I was always crying and always felt guilt because of unwanted thoughts I got from them. I didn't develop OCD like symptoms until the meds. So I started Briviac 100 milligrams two times from Keppra. So the anxiety has gotten better. I feel like my brain still experiences OCD thoughts. Could this have happened on any of these meds? I think they're asking, could the OCD have happened during the meds? I'm not sure. I'm not exactly what OCD is and what it can do to you. I've heard of it, just don't know what it is.
OCD stands for compulsive disorder. It's a diagnosis, it's not a symptom. So if they have OCD already, it could exacerbate symptoms, but I don't think that it could cause them to suddenly become OCD. If that
Yeah,
was the question, I don't know if I
medication
misunderstood
doesn't
it.
give you OCD.
Yeah.
It can
It's
cause
a
mental
it's
health
a
problems, and they could be reading symptoms of OCD and think that their mental health issues line up with them. But um, sorry, I jumped in. Kevin, what were you saying?
no. I mean, I think you were on the right track. I think perhaps they're, you know, on WebMD or something. Yeah, it's a psychological condition. It develops over time, and um, it doesn't. I don't think. Not a professional, but I don't think pills give it to you.
Like Keppra is a mood changer, but it's not going to give you OCD. That's something that was already developing,
Hmm?
And Briviact is just Keppra 2.0. So
I'll read these comments. One says, I keep hearing about these type of side effects and it just puzzles me. I take 3,000 milligrams of Keppra a day and 200 milligrams of lamotrigine, and I never had side effects at all. Another comment here says, I'm on 250 milligrams 2 times a day of lamotrigine, and I too haven't had any side effects. Another comment says, for me, it would be important to have any more seizures. Oh, to not have any more seizures, but it seems different for many people here. Another one says, I didn't get on the Motrigine at all. I felt like I was in slow motion and serious brain fog. I've not had OCD type thoughts or impulses on anything, though. Certainly not kept a rage. Oh, certainly kept a rage.
OCD type, like, I don't understand that. OCD type thoughts. It's like are they confusing it with something else? Because OCD is more like a compulsion of like someone who always has to have, you know, things go there, like the blue books always go on the left and like stuff like that. It's and I'm just using that for an example, but it's
All
like
right.
it
If you watch Always Sunny in Philadelphia, like Charlie Kelly's mom The way she always flips the light switches 3 times before she goes and does everything in threes. And there's one
Yeah.
episode he asks, why do you do everything like that in sets of three? And she says, "Oh, honey, so that you don't die." And just walks away like that's a completely rational reason that it actually prevents anything. There's a compulsion that they can't give up, which is the doing things in threes, and it's obsessive. It takes up all of their daytime, all of their nighttime thoughts and energy, and it's not something rational. Um,
It's
it's
meant to relieve anxiety about something, but there's no real connection between the two
yeah,
in reality. The flipping the light switch gives her, relaxation, but there's no real connection between prevention of death. And there's other things too, but
yeah, like obsessive cleanliness is another example. People who need everything to be clean, and if it isn't, there's an irrational build of tension that, you know, I don't know, that something is going to happen. And it could be like a diffuse something that they can't necessarily name, but um, that irrational tension with a disconnect from reality is that disconnect, like Kevin said, is a very important part of it. Um, um, but yeah, it's a serious condition. It's not something that just arises um, out of um, a temporary side effect from a medication like that. So
Yeah. Yeah.
I'm
Like,
skeptical about that part.
I
But
agree with you 100%. And like the only thing that was different was Kepper rage was different. Like you can feel anger coming in you, you know, and it's coming from out of nowhere.
I got something here. It's just asking for support. And it says, I feel like a failure. I have been having roughly 3 seizures a week for about a year and a half. I have had one, I have had 2 1-hour EEGs, and I'm now finishing up my 24-hour ambulatory EEG. I feel like I have let my family down by not having a big seizure while being recorded. I have had a few auras on the 24-hour one, but not a larger episode. My having seizures has meant being on disability from a nursing job and out uh, from a nursing job and out family is really struggling financially. So I just wanted to test to be really good. I'm on 300 milligrams of the cosamide and I'm still having frequent seizures. It has really stopped my life since before this. I was an avid hiker and kayaker, and that was my husband and my way of bonding, and I can't do that anymore. I'm 39. I feel that I have been having head drop and focal seizures for 20 years, but was not taken seriously by my doctor. But this last year has been turned into tonic-clonic seizures. I feel like an infant. What do I do? I just need I just need some support. Angel, what do you suggest? What would you like to tell this woman who is looking for support?
It's, I mean, they've been having seizures for a year. I just want to give them a hug.
Yeah, a year and a half, 3 a
Yeah.
week.
And I understand the pain of like you're you're being interrupted. You can't financially provide.
Yeah,
And
I know
then
this. I know what this
on
person
the other
feels.
on the other side, you got Social Security if they're American, who's saying, nope, not enough evidence. Regardless, that it's exactly what they say. Your life is interrupted and you can't provide, pretty much.
That's what I've gotten to. It's been about 10 years now since I actually tried to give a shit and do something about it, but I've twice been denied disability by my doctor, but at the same time I have zero energy to work more than an hour or two a day. I can't drive a car, so that limits, what I can do, my jobs, everything. It's like how do I not qualify for disability? Like I'm stuck in a position where if I wasn't lucky, fortunate enough to have my parents around and, still care for me, I'd probably literally be homeless. Like there's not an in between for it. It's just like we've talked about it before, it's like an invisible disability, You roll in with a wheelchair somewhere, everybody opens the door, you know, gives you, just like, oh, right this way. And but with epilepsy, it's still a disability, but nobody looks at it the same.
Mark?
Yeah, I think that when, she sounds like, um, there's I mean, it's a really new diagnosis for her. And I mean, something that came to mind, kept coming up to mind as she was going through her post is she seems to be the type of person who had a very like a set image of herself, um like crystallized in her mind already, like an image of who she was, who she was to not only herself but to her partner, to the community around her, how she would be seen, professionally, and all of this stuff. There was like an entire person in her mind that was her, that is all of a sudden now no longer gonna be, never gonna be.
Oh my
Um,
God.
it seems like I've been thinking about this. It seems like it's very similar, like the new, like fresh diagnosis out of nowhere type of situation seems very similar to the process of grieving, that the person is effectively, um, going through a grieving process for the person that they, for themselves, for the person that they had in their mind. So it's not just who am I going to be now? What am I going to do now? What, you know, part of it is just an emotional release type of thing that needs to be, or emotional buildup and release, or process that needs to happen. There's an initial, like, right, there are stages of mourning, right, that have been, there's denial and
Yeah.
grief, and I can't think of them all off the top of my head, but basically I'm kind of proposing that she and people in a similar position, new diagnoses, have to, or probably have to go through that grieving process just for their own self-identity before they can move on, really. And that's not always going to be an easy process. It's not going to be quick. Um, just like for any real person. Um,
Some of
I
us
mean,
have
there's a
been through
difference
this
that you.
process, though.
I'm sorry, Angel.
I said some of us have been through this process our entire lives,
Yeah,
and it's just, it's like we've been through it. We know what we accepted that, and sometimes the end result is like we still can't get that.
we've got to build a new self-identity on top of that, and comparing that new self-identity to the person that you used to have in your mind is something that's difficult to swallow. What can you do versus what could you do? Who are you now versus who you could have been? And I don't know. I think it might be, I don't know. Would it be good to avoid that comparison?
No,
Or-
it's a very correct comparison. The stages are denial, bargaining, anger, depression, and acceptance, and you can go through them in any order, but you kind of have
Kind
to
of a
go
grab
through,
bag of feelings.
yeah, and you kind of have to go through you go through the denial of you don't want to accept it, and then you're bargaining, well, what if this or what if that, and whatever, and then you're mad about it, and then you get sad about it, and you finally come to a place where you accept it in the place where you're at in your life. But
Mhm.
you have to kind of, I don't know, you have to grieve the person and the life that you expected to be in, for the person that you are becoming.
Yeah, with the complication that you need to figure out what next on top of
Yeah,
that.
exactly.
So,
And epilepsy is the one thing that just keeps taking and taking and taking.
Seems that way sometimes.
But this here says, could this be focal aware seizures? I don't really know how to describe it, but every once in a while, I get this weird feeling in my whole body, and the only way I know how to describe it is an out of body floating impending doom surge through my whole body. It lasts maybe 30 seconds, and my whole vision tunnels, and my hearing fades, and it feels like dying pretty much. I feel it hit like a boom in my body and feels like I genuinely die. I feel like I can't think or talk and I'm floating. I'm dizzy, out of my body, doom and despair, pit in my stomach. I also get eye jerks multiple times a day, and they always jerk to the right. Um,
Yep, that's focal aware.
Definitely the tunnel vision and the fading into dark and dizziness.
Yep.
Yeah,
the feeling like I'm dying part threw me off because
Impending doom.
I've had impending doom, but I don't know what feeling like I'm dying is feeling like.
Impending doom.
well, I only felt that like once
Impending
in
doom
that.
was bad, but I didn't feel like I was dying. I felt like I was just having a panic attack.
Oh, impending doom. That's what it's called.
Yeah,
Yeah, this person says I feel like it's
anytime
literally
you feel
dying.
death.
it's just
Yeah, this
a
person says it feels
greater
like I
degree of
genuinely
the same.
die. Never felt that. Could that be a focal aware seizure? Is what they're saying.
Yes.
Yes.
Oh, well, I didn't have to say it. There you go. Here's some comments. The first one says, "I've had very similar episodes, but they're far different from the focal seizures I typically have. I'm leaning towards panic attack for mine. I guess panic attacks can also come on with no obvious trigger. I don't know if there's any way to know for sure. Other than an EEG. It's only happened to me twice." Another post here. It says, "Nonstop pain. I'm a 28-year-old female, and I've had epilepsy for 17 years now, and 2 weeks ago experienced a seizure that involved me falling down the stairs and getting a concussion. I've had pain in my chest nonstop for over a week. Any recommendation other than Tylenol?" The first comment says, "That sounds absolutely awful. Hope you're doing okay. Definitely get that chest pain checked out by a doc if you haven't already. Could be bruised ribs or something more serious from the fall. Ice packs might help with inflammation, but honestly, chest pain after a fall like that really needs medical attention. And I suggest going to the emergency room."
No. I'm just kidding.
I was gonna say, why not?
Yeah,
What
I
do
No,
was
you
gonna say,
I'm
what do you
just
mean?
kidding.
What do you suggest, Twisted?
uh, Going to the emergency room.
I was gonna say I don't think I mentioned it on Friday. I can't remember, but Thursday evening, my nephew, he's only 2 years old. My my sister has to go into work a couple days a week, so there's like a daycare learning center or whatever that he goes to. My nephew, and he ended up getting his finger um like squished like in a
Oh,
door, and it ripped his fingernail off, like
oh,
there was just a little bit of it like left. And so he's 2.5, and it's just he's obviously crying his eyes out. And so yeah, she
oh,
took him to the yeah, I know. I did this when I was 4 years old. I ripped my entire fingernail
oh, no.
off. It's just kind of like ironic that yeah, but anyway, it's a whole separate story. But yeah, so she took him there and then found out that he's still really young, bones are brittle and everything, and it had like cracked the
The
like
bone.
the tip of his finger, but there was no way that it would have that nobody would have ever known if he hadn't actually gone to the ER and they had the x-rays done and things like that. So I understand that like some people are in whatever financial situation where it's not or their healthcare situation is it's not doable, but if you can, like, don't hide it, go and get it checked out and take care of that, because there was no way that they would have known that the very tip of his finger was
Broken
cracked,
up.
and then that could have led to longer lasting issues in his life, since he's only 2 years old and his body's still growing and maturing and everything. So yeah, if it's financially doable or whatever your life situation, then do it. Don't try and hide it.
Um, Mark, what do you suggest?
Do what?
I said, any suggestions?
I don't know what I would be suggesting.
Oh, you might have
I
walked
was
away.
I was a little bit distracted for a bit there.
Oh, this person is asking. They're having nonstop chest pain, and they fell down the stairs after a seizure. Um, yeah, 2 weeks ago, and still having chest pain. And they're asking for
Um,
suggestions and recommendations other than Tylenol.
Go to a doctor. Don't mess with chest pain. How is this even a question?
And it was experienced during a seizure as well.
Right. Yeah. Chest pain can be a symptom of some types of seizures too. So, um, and if it started during a seizure, then yeah, definitely. Even if it didn't start with a seizure, chest pain, period. Don't mess with chest pain. Go to a doctor, get a referral to a cardiologist if you need to. Go straight to a cardiologist if you're able. Um, don't don't wait.
Gotcha. Another comment here. One says medical CBD, great natural way to treat seizure triggers and pain. No opiates with medical CBD, no side effects. My neurologist explained how well medical CBD is for treatment of epilepsy. Studies have shown, been on here for 8 years after I had left temporal lobectomy. Take care. Another one said ice and heat. If you have access to community acupuncture, that can be great for pain. And the community model makes it very affordable. But as others have pointed out, please see a doctor. Um,
Ice and heat for chest pain? I mean, unless it's muscular, I don't know how that would do anything.
Yeah, it seems straight to the doctor. No, nothing against cannabis or anything, but I wouldn't mess around with CBD or any acupuncture. It seems this is a straight to the hospital thing.
Yeah. Yeah. Take the time you would have spent getting ice on your chest and dial the number to your doctor. Um, or, or grabbing the whatever medical CBD or driving to the whatever shop. If you don't have any medical CBD on hand, drive to the doctor instead or urgent care.
Mm-hmm.
I mean, at this point, even ER, maybe. I mean, if you tell a doctor or nurse in the ER you've been having chest pain, like they don't wait. If you
Yeah,
tell them it's
they'll
been
see
ongoing,
you instantly.
yeah, if you tell them it's been ongoing for a long period of time, they're gonna take that seriously. They're gonna, get you checked out, get an EKG on you right away at the very least. That can rule out a lot. Um, they might do a CT scan if the EEG is, but yeah.
Yeah, and in 2021, my dad was having, some chest pains, and it runs in our family. So my mom and I took him to the ER, and they saw him right away. They did, all these tests and everything. Um, and this was early in the morning, but by that night he was on the operating table. He had to have open heart surgery. He basically had a heart attack. That was what the chest pain was. But my uncle, his brother, obviously, he had already had three heart surgeries. He had heart problems. My grandfather, I think I've mentioned it before, he died on the operating table during a heart surgery. My great grandfather also died from a heart attack. So uh, I'm just waiting for it to happen to me one day, honestly. But
No,
uh,
no, no,
Don't
no, no,
say
no.
that.
It's not. Don't speak that over.
Don't
Yeah,
say
don't.
that.
It's the guy.
well, I mean,
You're
I'm
gonna be
40
fine.
I'm
You're
40 years
gonna.
old, and it runs in the family. I'm
Don't
sorry. I'm just
say
being a
that.
little self-deprecating. I'm sorry, guys. I'm sorry.
No, don't say that.
Don't be pessimistic about that. You're gonna
All right,
make
all
it.
right, all
You're
right.
gonna be
I won't.
fine.
But
We're the
Yeah, yeah,
pessimists.
yeah.
but
Come on.
but yeah.
We
Anyway,
should
when
we
yeah,
should build some optimism here. You know?
yeah. I mean,
Yeah.
yeah. It could go either way with me, but yeah. So yeah, he had his heart his heart surgery and everything. He was, back home within a few days, and he's still here with us and doing healthy and well and everything. But yeah, that's why I was saying, like, don't mess around, don't wait. If you have some chest pain, like, go in instantly. You never know what it is. Sure, it might just be like, oh, a muscle or something, but it could also be that you had a heart attack and you didn't, fully realize it or something. Like, yeah, get it checked out, because it could be either way on something like that.
My dad walked around for over a week thinking that he threw his back out and finally went to the ER because it hurt so bad, and they told him he'd had a heart attack previously and he didn't even know it.
Jeez. Yeah, see, so then yeah, you know exactly kind of what I'm what I'm talking about. Yeah. It should be looked at for sure. Don't like hesitate on it.
I got something. It says traveling to the U.S. from the UK. Insurance, meds, advice needed. As per title, I'm traveling to the U.S. for a week at the end of May. Aside from sorting out all the visa requirements and renewing my passport, I need to look for some travel insurance uh, that has a comprehensive cover for pre-existing conditions. Obviously, I have nothing will help. Nothing will happen as my epilepsy is well managed at the moment. But I'm changing meds in February and don't want to risk not having good cover in place in case anything happens. Has anyone had good experiences with certain insurance providers or can give good advice as to what to do to prep for a trip to the US? Thanks in advance. Um, I don't know. I never knew anything about getting insurance just while you're here type thing. I didn't know that was a thing.
Yeah, I hadn't thought of that. Um, I mean, best really depends on a lot of stuff. Like, what do you prioritize? Like, cheap or low cost or high coverage or what? I don't know. Comprehensive plan? Are they seniors? Do they
um,
have pre-existing? Yeah, affordable with a pre-existing coverage? Would their or pre-existing coverage take some and you supplement the rest with, I don't know. Yeah, what does their existing coverage look like? Wait, from the UK, I guess. So
it takes
are they just
200.
are they
She's
just
like,
on the
no,
NHS? So do they not have any insurance coverage aside from the NHS? Because there
it
are,
doesn't
well, I
say.
mean that wasn't something that, yeah, I'm just thought process out loud. What are their problems? What do they need, right?
Um, the TLDR at the bottom says, I'm going to the US. I need travel insurance that covers epilepsy and covers it well. That's the main
Yeah.
question. Um,
Yeah. But I'm just working out, like, I could
My
sit
best
here
advice is just
silently
don't
if
come to
you
the country
like,
right
but
now.
I'm just working out what they would need. What do they mean by best? Even that is not, good coverage for epilepsy does not necessarily have a lot of specificity to it. It could mean a lot of different things to different people depending on their. So I'm just, what I'm
mhm.
looking over here, what visitor coverage is. U.S. health insurance for UK citizen. Is it
That's a
better to
thing.
buy travel insurance from the USA or from the UK? It could go either way, right?
I'm unsure.
Ba-ba-bum. What would they
Um,
need? Do they have enough medication for their entire trip? Which is something they didn't say. But would they need a refill beforehand, or would they need a refill while they're traveling? Is that something they definitely need to have covered? And if it is it something that's like that a program like GoodRx over here in the US would cover so that they could get it at a reasonable price even without having to have insurance if just a refill of what they're doing is what they need. Um, I don't know, there's so many questions that would need to be asked of OP to take apart what their question or what their answer, what the best answer to their question would be without, so I don't know. I
There's
guess
one comment here.
after all of that, I have to say I can't answer their question. I should have just stayed quiet.
Well, I got something here. It says make sure to bring way more meds than you need, like double what you normally take for a week, just in case flights get delayed or whatever. Also, keep them in original bottles with your name on them so TSA doesn't give you grief. As for the insurance, I've heard good things about specialized medical travel insurance companies,
Yeah.
but can't remember specific names off the top of my head. Maybe someone else can chime in with recommendations. Um,
Some of the big ones also offer, short-term travel insurance stuff, at least just based off of the cursory search I looked at over here. I saw results coming up from like, I don't know, top result was United Healthcare. So they're like big,
Um,
big one and the whole thing. So it's not just small travelized. Twisted, you have something to say?
when I go to Mexico, um, they offer you a plan, uh, which they, I don't know the name on the top of my head, uh, which covers you for the whole stay.
Is
Because
that
I
your middle finger?
remember, uh, they're coming for a week, right? Um,
yes.
I mean, that's an awfully short stay to be worried about this much. Just get extra of your medications and
yeah,
I don't know.
I mean, we don't know how bad their
I'm I'm
epilepsy
I'm
is.
sorry to have jumped
yeah.
in on your answer, Twisted, but when you said that like 1 week, I hadn't realized it was such a short trip. I thought they were going to be here for like several weeks, given, uh,
Yeah,
yeah, sorry, Twisted.
just 1 week, and I guess try not to get hurt in a week. But I guess for other people, they want to have insurance. They want that to be
Yes.
something they want to be ready for. Uh,
Yes. Just
Um,
hold your seizures in until you get home.
try
Trying
not
to
to get
hold,
a seizure.
I'm trying to hold on mine until next week.
um,
That's
I'm
smart.
just holding on until it comes. It's coming. I just don't know when. I can't stop it. Might
Just
be
try
two
to,
at one time.
Pookie, you need to schedule any vacations in between that 3 to 4 month cycle, right?
That never works. That never
No,
works. I tried that. Um, it didn't work. I actually had two.
maybe you should travel. You should schedule two vacations. One on the 3 to 4 month cycle, one off, like somewhere in the middle. And then when you get close, if you start feeling seasy, then you can cancel that one and have the other one so that, like, to outsmart your brain.
Oh yeah.
get it to think and get the seizure out and over with before the so that you can have the you know
I know what you mean. Gotcha. Um,
I'm surprised you know what I mean there. That was
Yeah.
yeah, it's hard to explain, but I understand what you mean.
I
Yeah.
like the word Seizn. I don't think I've heard that one yet.
Easy.
yeah,
Yeah.
Seizn.
Seezy. Yeah. Feeling seasy today.
Sassy. Easy.
I got something here. Does anyone have any difficulty regulating their breath during a seizure? The first
Yes.
comment here says, first comment says, I have aware seizures, but my mind goes blank and I can't speak. I tend to pant. I don't get conscious control of my breathing until the seizure starts winding down. Anybody having focal awares? That's what that is.
What was the question?
You raised your hand. I forgot the question. I'm just kidding. It said
Anybody having focal awareness was the
Me?
difficulty
question.
breathing,
Yeah,
regulating your breath.
controlling your breathing while having focal awareness.
I think we're all having this problem.
I do not recall.
Vocal aware,
I'll assume that I have that problem, but I
but
can't say that I have.
they're called vocal they're
I never
called
been told
vocal
that.
aware or
Vocal awares.
awareness.
Yeah, I don't remember this one. But I do remember.
Maybe we can just talk about it again.
Yeah, go ahead, ask it.
Okay.
We'll talk about it again. No big deal.
It says absent seizures. Can you be startled during? Firstly, I want to thank you for sharing your honesty and experiences with me. When your child or yourselves experience a seizure, can you be startled? I saw a video online which child epilepsy diagnosis was debunked due to the child reacting to a sudden boo from their mother, which they caught on video. My child has an episode today, and I tried this. My child screamed, jumped, and instantly came back around. Is this possible to be an absent seizure? My child has recently been diagnosed with epilepsy after experiencing seizure symptoms for 5 years.
Yeah, I don't really have that much to add to that one because I don't remember, before and during and after mine. So I yeah, I don't know if something specific would wake me up or not. I know the couple times I've had them at the hospital, they've, given me some sort of medication that wakes me up from it, but I don't think any like certain like saying a word or yelling or something like that, for me personally would change anything.
I wondered that if that might have happened when I was having a wandering seizure, if someone just had stopped me and started having a conversation on one of those buses or the train, might that have changed the course of that trip? Um, Maybe I wouldn't have wandered as long as I did. Uh, it's interesting that you say that, James, because now I'm thinking, can I be scared out of it? Or not necessarily scared out of it, but having a conversation would basically, I'm assuming I just took these three buses and trains, just like not talking to people, maybe sitting alone. But yeah, if someone was to talk to me during a focal unaware and I'm just not myself, might I have answered?
Like
I think that
perhaps, yeah, if you were on the bus and somebody said, like, just started talking to you, like, "Hey, Pookie, what's up? Where are you going?" Something like that. Do you think that would have snapped you out of it?
I think so.
I
Okay.
think
That just
it's
came to me
that
now.
what they're talking
money.
about is different. What they said sounds more like the startle response is something that is reflexive. It's not something that is consciously mediated like conversation. So that's what they were saying, that that's the big difference there. If it's something that they are consciously responding to, like a conversation, then they're not unconscious. They're not having a seizure in that way that they were trying to display. Um, the when you're startled, it's a sudden jolt in the sympathetic parasympathetic nervous system that causes, the sudden fight or flight reaction. That's something that is, triggered autonomously, not um, through a conversation. So I don't think that, somebody having a conversation with you during one of these seizures is the same thing as what the OP in the Reddit post there is talking about when they say startled during a seizure.
So something a little more then. All right. That
It would be
that
interesting
wouldn't.
though if it's a focal aware. I mean, I've had seizures where I've had the physical symptoms and there's been somebody there and I've had a degree of awareness or in like an ability to respond in, I mean, at the very least I can say to a limited degree. I don't know how much, if it had been pressed to the point of like a conversation, if it might have actually helped like ground me, kind of thing, like sort of a meditative thing might, if it's taking place in a different context, you know. Um,
I was thinking
it's,
like just the
it's
way
a
that
very
they
interesting idea. I like that.
was I was
James.
thinking the way, at least how they worded it, that it was probably like a grand mal seizure, because I don't know if you're just zoning out, just distancing off or something. You don't need to be quote unquote startled out of it. Like you're sitting there, not really paying attention. It would be like, I don't know, something a little more violent, that yeah, like if somebody's using the word startled out of it. So I'm thinking it's the
Um,
grand mal type, but that's
they
that's how
they
I
didn't
took it at least.
exactly they didn't exactly say startled out of it. They said startled during it.
Oh,
Um,
I don't I
then
don't
yeah, I
know
guess I
if
don't
it
really know what they mean then.
I don't know if that really makes that much of a difference, you know?
Well,
yeah,
seizures are not my area of expertise, but I
You're not a
but
doctor.
yeah, um, I so I guess yeah,
I
I don't
think
know
what
why
they're
I'm tell
asking.
I don't know why I'm telling you that they're not my area. So
Yeah, I mean,
I
I
think
definitely
that
know what the person means. I don't want to like get down to semantics, but like I'm just saying, like, yeah, that was my opinion on it. Like, to give them, I guess, proper advice or whatever. It just seems like, yeah, if your body's just kind of sitting there, your just eyes are staring off, like that type of seizure, then there's nothing to be, to bring you back, to normal or whatever, whatever words you want to use to startle you back. Like that it just seems the way they
um,
worded it, it would be like a grand mal. I'm not. It's just a different, yeah,
there
different type, different advice.
what I'm taking it as is they're not saying that they like jump to scare the child. Um, Maybe this child got scared at something that they heard them doing or something like that, but startled during and startled to wake to come out of it. I don't think that's what they were saying. Uh, yeah, and her child, she said, did the same thing after she watched that study that she heard. But you never know what's possible these days. Me personally, you wouldn't know I'm startled. I get up and I leave situations. I might run or get out of the ambulance if I can. I didn't get out last time because they stopped me, but if I had a little few more seconds, I probably would have got out. I got the door open. Yeah,
Damn.
I got the door open, so I was almost out of there. And,
Almost.
almost doesn't count, but I had the door open
Almost.
and the guy was right behind me, and I guess him putting his hand on my back, something told me just get back in, just stop fighting it. Like I could have jumped out if I wanted to, but yeah. He started talking to me and I was just like, all right, I'll get back in here. Um,
That's
did you
funny.
have something, Angel?
No, I just got back. Just a whole bunch of commotion going around here.
Oh, okay. Um,
What happened?
It's crazy. It's just like you know how there was an ice storm around here and everything. So
Oh,
people digging out spots and people stealing other people's spots. So my sister had a cone in one spot. Her
okay.
car got her spot got stolen. So what she did was put the snow right back into the
mm,
spot that she had dug out because somebody whoever took the spot, she put the snow right back.
mm.
That is some A-level petty.
I saw
Yeah.
people
Yeah.
pouring water on the snow. They would put the snow back on their car and pour water on it so it freezes back over.
Yeah.
And
Nice.
I
Very nice.
remember when I was living in Chicago, man, that was A level pettiness.
they work hard. I mean, they saved their spot.
Yeah, I
Yeah.
Social contract, people.
yeah.
I got
They
something.
called the cops on my sister and everything, and the cops like, we can't do that, and she's not touching your car.
Mm. I got something here. It says crisis and cluster every night. My son has cluster seizures every night, some with intervals of hours, others of minutes. And when it's really bad and we have to take him to the doctor, they come one after the other. It's very distressing. Has anyone managed to control them? He takes oxycarbazepine, lamotrigine, and lacosamide. Um, I'm not having clusters, but I didn't know that's messing with your brain having clusters every night.
It is.
It
Um,
is.
One comment here says ask for Clonopin or similar benzodiazepine. That's what I was prescribed after one night of cluster seizures lasting for over 2 hours with a 15 to 30 minutes in between seizures. It prevents another seizing happening without having to use the rescue med.
Yep.
It is a rescue med.
Yep.
What do they mean? You don't have to, maybe you don't have to use like a nasal spray or whatever,
Well,
but it's still, an oral
I was
rescue.
I was prescribed after I started having clusters. I was prescribed clonazepam nightly, and on top of that, I also had the dissolvable one to use just in case. You know,
Mm.
I've always heard that after a couple weeks of daily use, um, that the clonazepam may still have some effectiveness in terms of the psychological effects, but it loses almost all of its anticonvulsant effect due to like a tolerance.
Yeah.
Um, so um,
I was getting.
I don't
I
know.
don't
Taking
know.
it daily, I had been told that it was basically when I had been on it daily. That is, I'm not saying you. I had also been on it daily back starting in 2011, but I was given it for panic attacks. And they said that my panic attacks were, actually focal aware seizures. Now that, we know that, but they were coming so frequently that they just gave me the clonazepam daily because they said I was going to be basically, it lasted so long that it was basically going to end up kind of at a baseline like that. And that they were just kind of staving off withdrawals at that point. It wasn't really doing much of anything for me. Um,
Yeah, that was one of my concerns when I requested to get off of clonazepam because being medication resistant sooner or later, it's like, look, if this is the only thing holding back the floodgates from letting all the seizures come, they're going to come through with hell, you know. And then they had me on Xcopri too, and I was like, all right, stronger med, but the side effect of a benzo and Xcopri is just too strong.
And you're only on Xcopri?
Right. And that's, yeah, because I requested to get off of um the Clonopin.
So you just take the Xcopri once a day?
I take my Xcopri and my mefsuxamide. The mefsuxamide is for the absent seizures.
Oh,
And I don't even know if that's working. I can't tell. I have no way of catching it on camera. My ex-wife used to know, but it's like I heard somebody on Epilepsy Universe says they have a what is it you guys got, Kevin, Mark? VNS or DNS?
VNS.
DNS.
Yeah. I heard them say they have one to control absent seizures. I was like, how is that possible? Don't you need to swipe like the magnet for when you have a seizure? I don't even know when I have an absent seizure. It's like I know I feel confused and stuff and like lost, but it's like
yeah, if the heart
you
rate
can,
spikes in conjunction with the absence seizure, then um,
yeah,
it would detect that and automatically give a
Stop.
dose, like a higher, larger dose than the regular normal
yeah.
Um, so
because
I don't know how effective that would be. I don't know if absence seizures often come with a spike in heart rate. So who knows? I
and
mean, mine isn't even at an effective therapeutic dose level yet. So, um, Kevin's really the expert in that
Kevin's the
regard.
pro, but he's myoclonic.
Hmm. Yeah.
No
So
absence seizures.
Sorry, I was looking at something.
You have myoclonic seizures, no absence seizures, right?
Right.
Okay, yeah. We were discussing whether the VNS is effective for absence seizures, since you wouldn't, by definition, you wouldn't be there and able to swipe the magnet yourself.
Hmm.
yeah, and so like people, they were
Does
saying like people can have like hundreds of absence of seizures a day.
does your
I would have
VNS
no
come with
idea.
the does yours send the automatic dose with a heart rate spike? Because mine connected to the uses its connection to the vagus nerve to um uh check for a sudden increase in heart rate, since they said, I mean, they said, I don't know, I'm taking their word for it, that up to 80% of seizures come with a significant increase in heart rate. So um, if the generator detects a sudden jump in heart rate, it sends a pulse, um, not as strong as the magnet swipe, but stronger than the regular repeat dose. It sends it to the vagus nerve there.
Okay.
And so
Okay.
I wasn't sure if absence seizures come with a heart rate spike. I wasn't sure if you had any thoughts on that.
I'm trying to think. So, the myoclonic seizures are very strong, so I know they're coming on. Um, they are not subtle. They are. Um, I don't know uh, the absence seizures. I don't uh, know what they're like. I don't know if you feel them coming on at all. Uh, yeah, that's tough for me. But or tough for you. It's tough for I can't tell you if
Like I know when I spoke to my current neurologist, like he was looking back at paperwork I had given him from EEGs of my past, and like he suggested juvenile absence epilepsy, and like because even when I wasn't having seizures or anything, there was always abnormal EEGs.
Abnormal EEGs, but were there any noted episodes of absence,
Um,
especially associated with any of that abnormal EEG activity?
I would have to like for the older EEGs, I would have to try to remember because that was so long ago.
Mm,
I'm in my 40s now, Mark. So,
mm,
and this
mhm.
happened when I was like 14.
all right. I got something in here. Uh, when VNS is considered for absence seizures, if it's if seizures are drug resistant, uh, medications cause intolerable side effects. Uh, uh, Not much else besides that. But focal seizures. Um, uh, it, it, it's more effective for tonic-clonic and focal seizures, moderately effective for absence seizures. Um, yeah, there's a lot. There's so many seizures that I can't look that up right now. But uh, yeah, there's a lot of information. Um,
Those sound like the same sort of the same reasons for absence seizures that they would, or that I recall being told for my focal to generalized.
Yeah.
Are absence are I have been under the impression that absence seizures are all um, generalized seizures. Do you know if that's true?
I saw something different where, yeah, I think I saw something where there's basically like three types of main, where it's focal and like focal motor or something like that. Then there's generalized and absence, and then there's unknown and absent. And I feel like the unknown is where complex partials will come in.
Everybody's body is different, and we're not doctors.
Please take medication as prescribed.
Please take your medication as prescribed.
I'm about
Right.
to go to bed.